It started with an idea, a mission to support AIDS patients with a meal delivery once a week by a few people at First Presbyterian Church of Philadelphia. It has grown into an organization that now offers food 365 days a year to those who are suffering from not only AIDS, but also other various debilitating diseases. To date, Manna, which stands for the Metropolitan AIDS Neighborhood Nutrition Alliance, has nearly 3,000 volunteers and has served over 1 million meals. This is Manna's story. In 1987, AIDS was a disease on the rise. It was a deadly disease with no cure in sight. As it made its way into large cities and small communities, people everywhere tried to learn as much about it as they could. 7 people in the church session at First Presbyterian Church of Philadelphia were no different, and as they learned more, they decided to dedicate some of their mission money and volunteers toward a program to help feed local AIDS patients.
At that time, AIDS was a death sentence, and so many of the people were alone. They had lost contact with family members and friends and co-workers, and they didn't feel like preparing meals for themselves. So we figured that as a church group we could do that. We started just a small program with a few meals being delivered to AIDS patients who were referred to us by an AIDS service organization that had case management services for people with AIDS. And we took some training to find out what it was like to work with people with AIDS and to really try to figure out what was needed that wasn't being provided. And we didn't want to duplicate any services. But by 88, we knew that patients were at great nutritional risk for a variety of reasons.
The group from First Philly reached out to a well-known service organization in Manhattan that directed them on how to provide for the AIDS patients. With that information, the group approached the clergy and lay leaders of the congregation and expressed their desire to provide an outreach for those stricken by the deadly disease in their communities. The church agreed to support this vision. It began with 1 delivery a week to 3 AIDS patients. The deliveries consisted of 3 meals, which were made in the volunteers' homes. The volunteers quickly became attached to the patients they were serving, which made the inevitable hard.
We had multiple deaths every week when we started. It was hard on the volunteers, it was hard on the staff. You know, for the patients, it was just unimaginable what they went through.
As word spread about the service, the number of meals that were being served quickly grew.
The main thing was that we've never charged for the meals. And the meals were really meant to be an unconditional gift to people who had very, very little. And, of course, for many of them who felt like it when the volunteers delivered the meals, it was a nice contact with another person who was non-judgmental and was happy to be there.
By 1989, the outreach had grown to a level where the 7 volunteers at First Church of Philadelphia decided to become a non-profit organization. The church donated $10,000 and provided a small Sunday school room and the use of its kitchen to Manna. Churches in the 5-county area were targeted for donations, and Valley Forge and Bryn Mawr Presbyterian churches were the first to respond with very generous donations. Many organizers have since named Manna as a recipient of their fundraising efforts, including the Dancers of the Pennsylvania Ballet, which has raised over $1 million through special performances during its 25 years of donation.
I'll have to say, for all of us, this was a great leap of faith. We had great talent and expertise collectively in the 7 of us, but none of us had started a nonprofit organization. So that was a real challenge for us. But as we turned to each thing that needed to be done, we found people to help us and learn ways of doing things.
Kay was eventually named Manna's first executive director. Overseeing the program was admittedly a huge challenge that came with many turns and bumps in the road. However, with the proper faith, things seemed to continue to move forward.
And there were many times when we didn't know if we would be able to make payroll or buy the food that we needed for the next month. And it was really interesting how so often when we were kind of in the woods, some organization or someone would appear who was interested in helping us and might even have the exact expertise that we needed. So we felt that we were on the right track with all of this.
For the first several months as a nonprofit in 1990, Manna reached out to local restaurants to provide the food that was then delivered daily to the AIDS patients by the First Philly volunteers. The growing demand for the service caused Manna to move to a new location just 9 months after becoming a nonprofit and also hire a full-time chef to prepare the meals. Eventually, nutritionists were brought on the staff to help create meals that were tailored to each person's needs.
You know, we could not have done this without the way people from all phases of life and all different occupations responded to Manna. By 2006, when AIDS was no longer a death sentence, Manna began serving other people who were at risk for good nutrition, cancer patients, undergoing chemotherapy, and renal failure patients are the primary patients now being served, but there are others, and it now works with 11 different menus to serve based on the patient's nutritional needs. So our volunteers, diverse gay and straight individuals and organizations, some who knew people we were serving, others heard about us through word of mouth or attending a fundraising event, many of whom did not know whether or not they knew anybody with HIV/AIDS, but they could understand hunger. We started out initially at the church delivering to three people with AIDS, and by the end of the third year, we had delivered 50,000 meals because our volunteer corps had grown, and we've been able to grow our staff as necessary. And this year, in the last 2 years, Manna is serving 1 million meals a year and has between 2,500 and 3,000 volunteers who help with every single phase of the operation. They do fundraisers. They make contacts for Manna with donors, with groups who are interested in supporting Manna. And what was very interesting to us from the very beginning and has continued to be was the diversity of people who have supported Manna.
Currently, Manna provides 3 meals a day, 7 days a week. Drivers are now paid to take food to distribution centers in Philadelphia and to parts of New Jersey, delivering to churches, community centers, and other AIDS service organizations where local volunteers pick up the food and distribute it to people in their communities.
We had hoped when we opened the doors in 1990 that we would at some point, hopefully in the not-too-distant future, be able to close our doors. That was the hope, that there would be a vaccine, there would be, I guess, maybe not, we didn't think there would be a cure immediately, but there would be medical treatments that would enable people to live, more comfortable and more productive lives, and of course that didn't happen. So it was, of course, when we look back, it's just incredible that people are still responding, people are still carrying the mission, and it's really lovely in all of the PR that Manna does and has through the years since all the founders have been gone. They always start out with mentioning how this program started in the First Presbyterian Church at 21st and Walnut Streets. And so, as I said, the mission is carried, and for a lot of people, especially the directors, and there are volunteers who started when we opened our kitchen in 1990 who are still volunteering for Manna. Manna, in its 26th year, has moved into a wonderful new facility that allows space for everything that needs to be done, all aspects of the operation. It has has kitchens with walk-in freezers and refrigerators and all of the space that's needed to do all of this. So 26 years later, It is going really well.